A simple interrupted suture is the most basic method to close tissue. It gives the surgeon maximal control over apposition of a surgical wound. The needle is introduced and rotated through the tissue as we discussed previously. Once the needle is retrieved from the tissue, the suture is pulled along its length until a short tag of suture remains. Ideally, the suture tag should be about 2 centimeters, enough to use to tie the knot, but not too much, which will be wasted. An instrument knot is then tied. The correct placement of simple interrupted sutures regarding distance from the cut edge and distance apart will depend on the tissue you are closing. Watch as additional simple interrupted sutures are placed. A simple continuous suture is very commonly used to close tissue. It provides less exact apposition than a simple interrupted suture pattern, but the level of apposition is frequently sufficient. Generally, for wounds oriented from side to side, surgeons will work from their dominant side and work away towards their non-dominant side. For wounds oriented up and down, begin at the top and work down. Begin with a simple interrupted suture. Continue the tissue closure, advancing symmetrical distances each time. The needle should remain oriented 90 degrees to the wound for each bite. At the end, the suture is tied to a loop of suture using an instrument tie. When tying to a loop, use steady, even, horizontal pressure and keep your needle drivers open to allow them to naturally go to the apex of the suture loop. A continuous suture line can also be tied with an Aberdeen knot, which is similar to a crochet chain stitch. To perform this knot, hold the loop open with your dominant hand and hold the free end of the suture in your non-dominant hand. Pass your fingers of your dominant hand through the loop to grasp the free end of the suture near the patient's body. Pull that new loop through, allowing the original loop to tighten. Repeat this process 4 times. After the 4th throw, pull the free end all of the way through the loop to tighten the knot. The advantages of the Aberdeen knot are that it is strong, secure, and less bulky than a traditional square knot. The forward interlocking suture pattern is a continuous pattern that allows improved tissue apposition and tension distribution. The forward interlocking is started with a simple interrupted suture. After the next bite is taken, the suture is pulled through the loop in the suture. This locks the suture after each bite. To end the suture pattern, take a reverse bite and tie off to the resulting loop.